Lagos Traffic Radio 96.1 FM. Talk Time is the program, and of course we set for the conversation this morning. So today we are scrutinizing the state of cancer care in Nigeria, progress, challenges, and future directions. Why are we doing that? Well, like we do say all the time on this platform, one conversation is never sufficient to discuss any subject matter, and that's why we are revisiting that. From time to time, we've always tried to see how we can bring lots of advocacy on the various types of cancers and what we need to do at every point in time. But today, we are connecting with the Nigerian Cancer Society. So let me bring all the big weights right here. They're right here with me in the studios. Professor Abidemi Omonisi is president of the Nigerian Cancer Society, and he's joining us right now in the studios. Prof, it's nice to have you in the building. Good morning.
Thank you so much. It's a pleasure being here.
All right, then he's been joined by Professor Adamu Bojude. If you're wondering who he is the Secretary General of the Nigerian Cancer Society. Prof, it's nice to have you. Good morning.
Thank you, Mr. Victor. Thank you, Lagosians. Thank you.
All right, then, and I have Princess Tinu Lawal, who's a regular on this platform. She's the chairman of the Nigerian Cancer Society, Lagos State branch, and she's joining me right here. Tinu Lawal, good morning.
Good morning, Victor, and thank you for having me this morning.
All right, then I see one more person. Dr. Olayinka Popola is here. He is the chairman of the Nigerian Cancer Society from the Federal Capital Territory in Abuja. Dr. Olayinka, nice to have you in the building. Good morning.
It's nice to be here. Good morning, Mr.
Right.
Terry. Good morning, everyone.
Great. So it's a loaded house indeed. And the big question people will be asking, why is the executive body of the Nigerian Cancer Society, why are you in Lagos? Let's start with the president, Prof. What's your visit here to Lagos all about?
Yeah, thank you so much. Lagos hosted the international, conference on prostate cancer, and we have delegates from the United States of America, from United Kingdom, and most of the country in West Africa. There's a consortium called Prostate Cancer Transatlantic Consortium, funded by Nigeria, based in America, that have been doing great work on prostate cancer, not only in Nigeria and West Africa, but annually, you gather people, across the world, to our country, and sometimes we also go to the United States to review situation, how far we have gone with time of, prostate cancer awareness, treatment, and also clinical trials in our region.
Professor Adamu, when did this hold?
Yeah, it started from Monday, but actually the program started much earlier with a lot of advocacy screening. That's across Lagos from last week, Thursday, Friday. There was outreaches to mosques, to churches, to some communities within Lagos.
Right, which is very, very good. Dr. Olayinka, how's it been? I mean, you are coming all the way from Abuja as well. Have you been in Lagos? Have you been finding Lagos?
It's been a great time here. It's actually 20 years since the commencement or the initiation of the CAP FTC program. Okay. And so it's been a significant experience. We have deliberated on issues. We have discussed on ways to move the cancer space forward in Nigeria.
Which is very, very good. And Tinu Lawal, you are the host of this particular conference in Lagos. How's it been for you?
Well, it's a very wonderful experience, and for me, I'm so humbled that it was the program happened in Lagos. Lagos is the center of excellence, they all say, and so it is believed that in Lagos we can reach out to everyone, everywhere in Nigeria. Right. So for me, it's really humbling, and I am very, very glad it happened in Lagos State. Exactly,
and considering the fact that we had so many people, what was the turnout like from the international community? Did you have so many coming from the United States and other countries?
Oh my God, the turnout was really, really great. Yes, we had different countries. We had Liberia, we had Ghana, we had several countries coming in. Other African countries coming in, joining us. Yeah, we had the Francophone countries coming
as well.
Yeah.
Wow. So where did this hold? Where did this hold in Lagos?
It held in Marriott Hotel, Dual Ogunaike Street.
Right.
Yes.
Okay, that sounds fantastic. So let's touch base with cancer care in Nigeria. Professor Omonisi, what progress? Omonisi, right? Yes. Okay, so what progress has been made in cancer care in Nigeria in recent years? Talk to me.
Yeah, thank you so much. Well, the bottom line is that we are not winning the war. although progress have been made in certain areas. For example, in terms of cancer registration, we make some significant progress. Before now, we have only one registry. Registry is an office where we collect, data on cancer, because we must know the pattern that we have. Cancer varies from country to country, depending on several, factors, environmental factor and genetics. So, in that instance, when it started, we have one, based in Ibadan, but now in the country we have 44. All the geopolitical zone, and then we have offices where we can have, data on cancer.
Right.
And also talking about cancer organization, Nigeria Cancer Society is the umbrella body of all cancer organization, in Nigeria. Before now, we have few organizations. Now we have quite a number of, cancer organization NGO that focus on cancer, across the country. So that's a big one.
Right.
But most importantly, the federal government have done a lot, in establishing what we call Cancer Institute, NICRAT, in National Institute for Cancer Research and Treatment. Now we have a dedicated government agency in charge of cancer treatment and research in the country.
And what's that agency called?
NICRAT.
Okay.
National Institute for Cancer Research and Treatment, NICRAT. Based in Abuja.
Right.
That has really helped. Then back to Nigerian Cancer Society. What we have in the past is a national body that's basically based in Abuja. But recently we've had chapters in all the states, in the country, including the Federal Capital Territory. That's why you can see Princess Nulawa, as the chair of Nigerian Cancer Society in Lagos State, because we discovered that having a national, society based in Abuja alone may not help. The state government, local government also need to team up federal government, to see how to combat this monster that we call cancer.
Right.
That's why we created state chapters, so that the state can work, state chapters of Nigerian Cancer Society can work with the state government, particularly the Ministry of Health and the State Cancer Control Program, to see how to, set up programs, that can help to prevent and also control cancer in this state.
And this was during your tenure?
Yes, this happened during my tenure.
So let me say kudos to you for that.
Thank you so much.
That's a big congratulations. Professor Adamu, well, you are the Secretary General, and when you look at Nigeria as a place, or perhaps as a country, in terms of the consciousness for knowing what cancer is, trying to do what is necessary in terms of diagnosis, and then even having to treat and care for cancer, what does it look like from what you see and from the perspective of Nigerian Cancer Society?
Thank you very much, Mr. Victor. This is more, I can say there is a lot of progress going on, but it's a work in progress. The federal government surely is really doing a lot, especially with the agency of NICRAT, but on the part of the Nigerian Cancer Society, especially with the coming of our current president, Professor Abidemi Omonisi, there is a lot of energy that is actually infused into Nigerian Cancer Society. We're looking at, he just mentioned about having to appoint and take the advocacy, the awareness, the treatment, the research, the data, everything to the states and down, involving the youths, involving quite a number of individuals, stakeholders, survivors and everything. So awareness is actually increasing, treatment is increasing. Once you are able to educate people for them to know, once they know, then there's a lot of progress regarding that, and on the part of the government there's also a lot of work. Quite a number of centers are coming up across the country. Individuals are supporting the efforts of the government. There are private institutions within Lagos here and across the country. So there's a lot of progress in Nigeria and there's a lot of hope.
All right. So I'll get back to what the society does, but let's just have feelers from the various, different chapters which you've mentioned right now. In terms of what you've been doing, let's talk first with Lagos. Tinulawal, I know you are the chairperson of the Nigerian Cancer Society here in Lagos. What has been the approach from your end as the chairperson?
Thank you very much, Victor. Right now, when we started in January, we decided to take things, easy. That is gradually. We all that we've been doing have just been preambles. It's been basically, advocacy, awareness, and all that. We have not really done any major outreach yet, and we're planning to start by February, where we will have all NGOs, all advocates come together and have a big outreach. Probably when we're doing the February 4th World Cancer Day. That's so. But so far, all that we've been doing has been preambles, just to get everybody ready and to kickstart.
And Dr. Popola, let's touch base with Abuja. I mean, you are right there at the eyes of the federal government. You are right there with even the headquarters of the Nigerian Cancer Society. What does it look like operationally when you are on ground in Abuja?
Thank you very much, Mr. Victor. The Abuja situation is not so far from Lagos, but we actually hit the ground running from the moment we were inaugurated almost 10 months or so ago. We joined forces with all the NGOs in Abuja to, contribute and participate in all cancer awareness programs. And right now we have encouraged the youth arm. There's an arm called UCAC to work closely with agencies and stakeholders. So our youth arm is basically interested in coordinating the youth to give awareness to the risk factors attributable to cancer. They are going around now to work on discouraging the use of tobacco among the youth. And we're also interested, and we've been working closely with NGOs that work particularly with childhood cancer, because we noticed that the adults speak a lot for themselves. They do a lot of things for themselves. The children are left behind. So we have taken it upon us to also work closely with NGOs and individuals that have interest in managing childhood cancer. So from the Abuja front, significantly beyond working with adults or for adults, we have also inculcated children and youths to come on board.
Lagos Traffic Radio 96.1 FM. Talk Time is the program, and I still have my friends from the Nigerian Cancer Society. And I was just having that word with the president before we went on that short break. You are giving me the prevalence rate, Professor?
Yeah.
Yeah, what does it look like, really?
Yeah, the burden of cancer is increasing, in the country, and we have the traditional cancer also not declining. I mean, breast in the females, in the leading cancer, and that have been for more than 2 decades. In the males, prostate cancer is also leading more than 2 decades. But where we have some shift is in childhood cancer.
Childhood cancer,
yes,
right?
Before now, we have Burkitt lymphoma as the most common cancer, but now we are seeing blood cancer that we call leukemia. More children are coming down, with leukemia. That is not very good news for us.
It's not.
And then we have some very unusual cancer that many years ago we thought, those are not cancer we see, in blacks, African, particularly in Nigeria. The black, cancer you see in the Western country because of their diet, and lifestyle. But we begin to see more Nigerians coming down with colon cancer and also die, from that. Particularly the young ones, they have colon cancer, and some of them also come down with breast cancer.
All right. Professor Bojude, I'm curious. Before now, we talk about diseases or some ailments that's a death sentence, so to say. Before now, we used to make reference to HIV and AIDS and all of that. Now, it appears cancer is taking over, and people are wondering, it appears once people contract cancer now, there is that fear, and that fear somehow leads to people, or perhaps leads to fatalities. Talk to me, is that still the case?
Thank you, Mr. Victor. For me, it's not the case. I know that, or we know in Nigeria or among the caregivers that cancer is actually difficult to treat. However, especially at the level of the Nigerian Cancer Society and the government, is we are promoting early detection. All the energies we are infusing into awareness creation, screening, outreaches, involving the youths, the survivors, is to detect detect cancer early, and once you detect it early, it's curable. And so that changes the story.
Okay, so it's not the case that cancer is a death sentence.
Yes, exactly.
All right. Timla, wow, you are in Lagos. Lagos is very, very active when we talk about advocacy for cancer and so many things. You are even coming in from the private capacity with an NGO that has been devoted to cancer advocacy. Talk to us this morning. What has been your assessment when you look at Lagosians and the way they, talk about or perhaps treat cancer, so to say? What has been your experience?
Thank you, Victor. I would say that Lagos is a lot more aware now about cancer compared to how it was in the past. With the energy that we've been pushing into advocacy and awareness, it's now it's not as scary or as stigmatized as it used to be. So now we have people even listening to us when we go to them, when we try to create awareness about cancer, unlike how it was in the past when it was like a cost coming to them, talking to them about cancer. In fact, these days people actually call me or send messages into my boxes that they would like to join the foundation and be be volunteers for volunteers of the cancer NGO. So I would say that there's an improvement in the awareness, and then which makes our work easier. The only problem we have is that poverty is still a very big factor, in making people detect early. Most of them, when they hear that they have to go to the hospital and they have to spend money, they don't want to go to the hospital to check themselves. So what we do is, whenever we have outreaches, we do free health checks, which enables people to have the opportunity to test themselves for whether breast or cervical cancer. Most of the NGOs, and the most activities of oncology happens down here. So I would say that there's an improvement in the knowledge of people about cancer.
Right. And Dr. Okpola, even though we have improvement in the knowledge, improvement in the consciousness, what of the manpower for care for cancer in Nigeria? From what you see, do we have enough people that are in this particular profession?
Yeah, thank you very much. Unfortunately, that is the new challenge. From diagnosis through to treatment, we seem to have challenge with manpower. However, that is not peculiar with the cancer space. That's a general problem with the country. But we're doing with what we have, on ground. Our colleagues are trying their best. At the level of Nigerian Cancer Society, we go around, we stimulate institutions, we stimulate organizations to, generate information or knowledge about cancer. We spoke about statistics a while ago. Okay. Actually, there are about 130,000 cancer cases every year in the country, and we lose close to 80 to 90,000 of them to cancer, specifically because, like Professor Bojude said, we have poor early detection rates. We're going towards detecting cancers early. There's a facility in Abuja that screens for cancers every year, and it will interest you to know that just this year, the screening for this year was initially planned for a week. It ended up screening for 4 weeks, and even after 4 weeks, people were still coming to the screen, and hundreds, were screened. The peculiarity, the challenge, I think that is ahead of us now is treatment. Okay. And why I'm bringing this forward is because our cancers, even though seem to resemble other cancers, seem to have some peculiarity with respect to aggressiveness.
You mean in Nigeria?
Generally for blacks.
Oh, okay.
The black race. Part of the reason why we're here in Lagos is to better understand and discuss the reason why men that are black, die early from prostate cancer. Prostate cancer seem to be different. Breast cancer seem to be different. Colorectal cancer also seem to be different. So we seem to not just have plenty of people coming down with cancer. Our cancers are a little bit difficult to treat. That's where the challenge lies now.
Prof, let me get back to you. As a president, he just talked about treatment now. So do we even have enough treatment facilities in Nigeria from the perspective of the Nigerian Cancer Society?
Obviously, no. Lagos is fortunate to be hosting more than 50% of oncology, center in the country, both private and government combined. In fact, Lagos is number one when it comes to that. But it's interesting to know that in 16 states in Nigeria, there's no single clinical, and radiation oncologist.
Wow.
And those are, professionals that are central in the management treatment of cancer patients. There's no way you treat cancer. It's not like malaria, where a doctor can sit down in the constitutional room and prescribe anti-malaria. You have a team that must manage that patient, and central in the treatment, cancer patient and the radiation and clinical oncologists. You don't have that in 60 states in the country. In a few states where you have one or two, that one have to cover, 2 or 3 other states.
Wow.
So treatment is also a major issue. The cost of treatment is also a major issue. To treat a breast cancer patient from diagnosis to stabilizing, that cancer patient, that patient will need an average of 20 million. How many Nigerians can afford 20 million? So that is the issue.
That's big.
Yeah, that's so,
and that's where funding comes to place.
Exactly.
Prof. So, what is the handshake? I mean, where is the government coming in all of this?
Yes, the federal government have done a lot in that regard. There's what we call the National Cancer Fund that was established by the federal government of Nigeria, and that fund is to raise funds. There's budgetary allocation for that. They also try to more fund from private sector, to support patients with cancer. And 3 cancers actually has been put forward in the last couple of years. That is breast, cervical, and also prostate cancer. People that have that cancer, they can have access to that fund. Federal government will usually support their treatment with 1 million naira, but that may seem not in that case.
It's like a drop in the ocean.
Yeah, but it's something. But we also have few states also that are key on board. Kano State also is doing the same. Also supporting cancer patients. And also have cancer organization at Tinukeya in Lagos and several other ones also support the cancer patients across the country. So the bottom line is that unlike the Western country where they have access to insurance, cancer being treated free, diagnosis all stages, the reverse is the case in Nigeria. The rich can be made poor by cancer, because it's quite very expensive to treat. So the bottom line is that there's need for government, to do something about that. NCS, Nigerian Cancer Society, have been the front for advocacy, to the government and other agency, and we are happy to say that government is responding, to all our, interventions.
Right.
And childhood cancer, for example, have added this year. Fragment have accepted to treat. What we are doing now, working with the various state chairman, is to engage the governors. We have planned to have interface with the Nigerian Governors Forum, because we think that the governors are very strategic in helping us, to overturn the table of the increasing burden of cancer in Nigeria.
Lagos Traffic Radio 96.1 FM. This morning we are scrutinizing the state of cancer care in Nigeria, looking at progress, challenges, and future directions. And I have a loaded house in the building this morning. Professor Abidemi Omonisi is the president of the Nigerian Cancer Society. I also have Professor Adamu Bojude, who is the Secretary General of NCS, Nigerian Cancer Society. Princess Tinu Lawal, also in the building, the chairman of the Lagos State branch of that particular society, and Dr. Olayinka Popola, who is also the chairperson of the FCT, Federal Capital Territory branch of that particular society. Let's get back to the road. Before we begin to hear from you, we did tell you that if you're making that journey to the island, most of the areas are still looking good. But flash update coming in from the control room right now from the Shangote Do end says there's a breakdown of a tanker loaded with petrol having mechanical problem at Nepa Road before underneath the bridge at Aja in what Ilaje. All right, and I understand the company is making efforts towards getting a tow truck to have it off. All right, affecting traffic, very little effect on traffic right now, but traffic managers on ground doing the needful. All right, you can join the conversation as well. 080-99-120777 That's 08099120777 and 09153877127. Those are the numbers that you can connect with us this morning. If you want to speak with my friends from the Nigerian Cancer Society as we reflect on the state of cancer care in Nigeria, looking at the progress, looking at the challenges, looking at the future directions. All right, let's take this one. This one says, good morning, Victor and the team. Okay, it says, good morning, Victor and the team of cancer advocates. My question is, are all cancer infections painful, or do we have some silent cancer illnesses? Let me see who's sending this one in. Some silent cancer illnesses. It says Mayowa. Okay, Mayowa is sending that one in. Prof, maybe you want to respond, Professor Omonisi?
Yeah, in fact, the matter of lung is that most, cancers are actually painless.
They're painless?
Yeah, and why are they painless? That's why I said sometimes the silent killer. When you begin to feel pain, that means that cancer has advanced and is eroding into the nerves, they feel pain. And that's why we advocate for, early people should subject themselves to early screening, periodic checkup. Some people may not have, may think that they are well, but they are incubating something there, and that's one major reason why, we have advanced cases that we see in our country and other, African countries, because why? We don't have this culture of regular checkup, and since there's no pain, there's nothing, and people think they are well, by the time they start feeling pain, the cancer has advanced, at that point, it may be too late, for them to, for us to intervene.
All right, so more reactions coming in on WhatsApp, 08099120777. You can also put your calls through on 09153877127. This one says, good morning, I am Ebenezer. Do I have a call? No. Okay, this one says, good morning, I am Ebenezer. Why is cancer treatment still too expensive for the average Nigerian? What can the government do to help us? Ebenezer, thank you so much. And I think Prof has alluded to that before now. He did talk about the fact that, yes, even though it's quite expensive, but government is trying to bring in one or two interventions. Another one here says, good morning, Mr. Victor, and to your guests, please, how can a regular family support a loved one with cancer without going broke? Thank you. If you're in saying that one, thank you so much. Professor Adamu, maybe I'll put that question to you. How can, you support a loved one who perhaps must have contracted cancer in the family? How can they do that without getting broke? You just heard from the president now saying at least to bring someone to the point of stability from the point of diagnosis we take up to 20 million, so they say.
Thank you, Mr. Victor. So there is this saying, but it's not actually saying, but that's the truth, that actually cancer itself is a community disease. It's unlike hypertension, diabetes, HIV, that one can actually keep it to himself, get treated, and even live with it for a very long time. In terms of cancer, it's actually not. It goes beyond.
Just a second. Let me see. Do you have a call?
Yes.
Okay, let's take this. Hello there. Good morning.
Yeah, good morning.
All right, you need to speak up a bit. Who am I speaking with?
Yeah, my name is Ayola.
Hey, Ayola, how are you doing?
I'm very good.
All right, so I have a full house here from the Nigerian Cancer Society. Ayola, where are you calling from?
I'm calling from K2.
K2, all right, go ahead.
I just want to ask the professor, why is it that recently there has been like a spike in the number of cancer cases in Nigeria? Like, almost every family now, they have one or two cases of cancer. I don't understand. What's wrong? Is it the kind of food we eat? Is it the GMO food? Or what's happening? We didn't used to have this much cancer in like maybe 10 years ago. So what's wrong now? What's happening?
Great question. Thank you so much.
Thank you.
Okay, I do appreciate you. And that is coming from Ayola. Prof, did you hear him?
Yeah. Well, there are many factors responsible for that, increasing burden of cancer, not only in Nigeria, in Sub-Saharan Africa, What we are seeing now is what we call epidemiological transition from communicable disease to non-communicable disease, and several factors have been alluded to that. Genetic. Some people, they have the gene run their family, but most importantly, environmental factor. That's what is driving the increasing burden of cancer.
He mentioned GMO foods now. Could that be resourceful?
Well, GMO food have been a issue of controversy, till now. But what I would say that is very clear is that there's change in diet and also lifestyle. Okay. People have abandoned a traditional diet. For example, for colorectal cancer, bulky food, high fiber diet. This fufu amala we are eating. It's protective of colorectal cancer. But most people don't eat that now. People eat canned food, baked food. Those are switched from a traditional African diet, to Western diet, and that has accounted for the increased number of colorectal cancer that we have in our country.
Right.
The issue of infection is also very key. Most of the cancer that we have in African continent are linked to infection. For example, people that have HIV, also linked to there are certain cancer that you find, people that have HIV terminally, people that have hepatitis B. Nigeria is one of the countries that have the highest burden of hepatitis B virus, in a continent. And hepatitis B, if left untreated, terminally it will transform to liver cancer.
You mean it?
Yes.
Wow.
And we have the highest burden. So if that virus is not treated, terminally the fellow will die either liver cirrhosis or liver cancer.
All right, then 09153877127. If you still want to join the conversation, feel free to do so. Prof. Adamu, you're just responding to how the family can support a loved one with cancer without going broke. Quickly, can you answer that in 30 seconds?
Thank you very much. So I want to tell you what we do in the clinic. Typically someone comes and there is this issue of funding and the rest. So there are some simple things we do. We have some organizations, or let me say bodies around town in the hospital, to actually see how we can help them raise money. And then there is support from government, especially Cancer Health Fund, as the president actually stated, targeting the commonest cancers, almost more than 60% of the cancers. So we also try to quickly enroll them, especially if they come with those diseases that it covers. Then NHIS, that also actually supports patients with cancer. And sometimes what we do is to actually say, if you work with the government or you have a relative that works with especially federal government, then you could add them as a beneficiaries. And so we have a lot of leverages that we can actually rely on to see that we actually support these patients.
All right, so more reactions coming in. This one says, good morning, Victor. Are there specific cancers that Nigerians are more prone to compared to other parts of the world? Maybe Dr. Popola can answer this one for us. Do you have specific cancers that are more prone to Nigeria? Dr. Popola.
Thank you very much. I think the number one cancer that I can say that Nigerians are quite prone to is cervical cancer, compared with other cancers.
Why do you say that?
The reason is because of the risk factors that are associated with cervical cancer. Number two is, just like the professor said, is liver cancer, because of the high burden of the risk factor.
So these ones are more prone to Nigeria?
Yes.
And not the breast cancer, not the prostate?
I'm coming to breast as, following cervical in terms of risk factors.
Okay.
And then breast cancer, of course, because of changing lifestyle, like the president said. And then among the children, we seem to have leukemia, and there's a disease of the eye called retinoblastoma.
Oh.
It's also quite significant among Nigerians. We don't know the reason why, but there seems to be a high burden.
All right.
And all these seem to be linked either with the environment that we live in, our basic genetic anatomy, or the decisions we take, our lifestyle. Yeah.
All right, then Tino, I'm going to get to you, because there's the issue of stigma still with cancer, right? I will talk about that. But this one says, good morning, Lagosians. Please, my question is there health... so my question is it that... my question is there health insurance in Nigeria that actually covers cancer treatment fully? Okay, Sheikh Ibrahim is sending that one in. Prof. Omanisi, health insurance, does it cover cancer treatment?
Yes, recently the federal government have actually accepted to incorporate that into what they do in NHIA. the United Society have been in front burner, engage the government to see what they can do, so that common Nigeria will not die from the disease.
Okay, so
the picture between the urban and rural chiefs is something different. Those in urban center like Lagos, some can afford it, but in rural communities near zero. Once somebody has cancer, just wait until the fellow just stop breathing. Because most of our rural community people are extremely poor, and access to treatment also burden.
All right, let me get back to you, because the issue of stigma still appears to be very high on the table when we talk cancers in Nigeria. These days, when there's a family member that is coming down with cancer or perhaps has been diagnosed, people really want to talk about it. Talk to me. Why is that so?
Victor, thank you very much for that question. I'm going to say that the issue of stigma has actually really gone down so much compared to how it was before, because people are actually coming out now to discuss it. Families are talking to themselves. Unlike in the past, even families were not talking to themselves. Husband was not telling his wife was also not telling the husband because of fear of stigmatization. So I think the talk is actually a lot better. That's why you see a lot of people come up on social media now to announce that they have cancer, or that their mother any of their parents has got cancer, or any of their family has got cancer and they need help. It was not like this in the past. It was not something that anyone wanted to discuss about because of the fact that it was believed to be that it was a curse from and nobody wants to associate with somebody that has been caused by the gods.
All right.
All right, then. But I would not want to leave us, because I can see that it's getting close to the time where we need to go. I wouldn't want to leave us without imploring the government and the corporate organizations that we have in the country to please support cancer advocacy, support
yes,
cancer
I'll still allow you to do that quickly. I still have some reactions here. This one says, is it true that eating certain foods in Nigeria can increase the risk of cancer? You didn't put your name, but thank you so much. Prof. Omanisi?
Yes, certainly yes. What it encourages that people should eat fruit and vegetable, that sense to help. Red beans, for example, have been shown to link with two cancers, cancer of the colon and the prostate. So we encourage people, especially people 40 and above, should reduce
meat consumption.
Yeah, red meat particularly.
So someone like me that loves meat.
No, please switch to fish. Fish, mass omega, and
okay. All right. This one says, why does chemotherapy seem to knock patients down so badly? Can't there be milder options? Bode is sending this one in. Bode, thank you so much. But is that true? Does chemo knock people down that much?
Yeah, thank you very much, Mr. Victor. So these are some of the side effects of chemotherapy, but I want to believe that the person giving it should have done some what we call pre-medication, post-medication, and once it's handled, the some of the drugs that are given to actually relieve those ones, like dexamethasone, things like some of the injections that we give, especially the fluids and some other measures that we give, and also trying to make sure that before you give the chemotherapy, you actually assess the patient very well. Make sure there is no anemia, make sure there is no dehydration, there is no infection, the patient is actually fit to take it. Once those measures are actually put in place, the patient hardly actually gets knocked off. And if it happens, the person should quickly inform the healthcare givers, especially the hospital, or usually we give our numbers to our patients and they can always contact us.
So there can be some remedy.
Yes.
All right then. So flash update coming in on the Lagos-Ibadan Expressway. Says there's an accident at Mowe inwards Lagos. That's an accident between a truck and a saloon car. All right. As we gradually wind to the end of the program, quickly, Tinlawal, you were talking about the suggestion of the corporate bodies coming in. How can they be of help in this advocacy for cancer care in Nigeria?
Oh, Victor, they can be of very great help. The CSR, they can make cancer one of their CSRs. They can support cancer patients, they can support cancer advocacy, they can support cancer awareness and all that, even cancer programs. We will be having some upcoming events in the nearest future before the end of the year. I'm talking about the Nigerian Cancer Society itself. Where even in Lagos, we're planning to have something for the Breast Cancer Awareness Month. So such programs can be supported by organizations, to help us project the message of cancer to the community.
Okay, then. So, Prof, I'll leave you with the last take, Professor Wanisi. So, what will be your take home this morning as relates to the future directions for cancer care in Nigeria?
Yes, I want to encourage Nigerians that cancer is not a death sentence. We encourage, early screening, early detection, save life. So let people subject themselves to, screening. We also encourage that people support, the work various cancer organizations are doing across the country, because, we must find a way to educate our people. Ignorance is still there, particularly in the rural community. Some people don't believe that cancer, do exist. I've been involved in medical mission to the rural community, where I met someone that have forgetting breast cancer, and then people said, it was stoned by pepper, atari of a thing. Right. So those myths and misconceptions are still there. So there's a lot that we need to do, and what we have decided, instead of making a society an Abuja thing, we are stepping it down to state and to local government, to the rural level.
Which is very, very good. So for those who would like to connect with the Nigerian Cancer Society, how can they do that quickly?
Yes, we have our social handles. We are on LinkedIn, Twitter, Facebook,
okay,
Instagram,
and it's just Nigerian Cancer Society.
Yeah, Nigerian Cancer Society.
Okay, all right. We'll leave it at that. We're hoping that next time when you come to Lagos,
we're actually planning to hold a massive program in Lagos during the World Cancer Day, as the chair have done.
Okay,
we'll be doing that in the 6th geopolitical zone. For Southwest, we are zoning to Lagos. It will be a week-long activity involving training, involving community outreaches, media engagement, and also consultation with relevant government agency. That will take place February 2026.
We'll leave it at that for now, Prof. It's nice having all of you in the studios. Thank you so much for being here, Prof.
Thank you so much for having us.
All right, so this morning we'll be able to scrutinize the state of cancer care in Nigeria, progress, challenges, and future directions. And my guest, Professor Abidemi Omonisi. He's been here. Of course, he's the president of the Nigerian Cancer Society. Professor Adamu Bojude, also coming all the way from Abuja, Secretary General of the NTS. Princess Tinu Lawal is the home girl, and she's coming home. She's the chairperson of the society right here in Lagos. And Dr. Olayinka Akpokmola, who is the chairperson of the FCT branch. We have to go. The program has been produced by Mike James, and I say a big thank you to Remy Aluko of our social media unit. Maximum shout out going out to Tayo Akonle, who is the executive producer of the program. My name is Victor Oteri. I'm out. Stay very much within. I'll be back by 10:15 for Maritime Today.
You can lean on me. There's a man, standing on the corner.